very good evening to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be really good. So today we are going to have this Insta live on a topic which is very close to my heart at least, and we are going to talk about acne management. And I'm sure you all would love to listen about how to manage acne because it's such a chronic skin condition, and those who have acne prone skin or oily skin, or those who are in their teens, and young adolescents, because they tend to have these acne vulgaris, or else in adults also are taking place. In men also, it's equally common. So today we are going to talk about acne management, and the special guest of today, who's going to join us soon, is Dr. Richa Sanmukhani. She's a renowned skin expert, and she is going to join us from Ahmedabad. So, Dr. Richa Gupta Sanmukhani, a distinguished dermatologist and gold medalist in MD Skin BD from Government Medical College, Vadodara, is the founder and director of Persona Skin, Hair and Laser Clinic in Ahmedabad, and specializing in trichology, hair transplantation, and advanced cosmetology, including laser treatments and facial rejuvenations. She has extensive clinical experience, previously consulting at Karmix Life Sciences and Sakhya Skin Clinic, Ahmedabad. Dr. Richa is renowned for her expertise in managing dermatological conditions and performing complex procedures such as hair transplantation, PRP therapy, laser treatments, etc., etc. And her research contributions include publications in PubMed index journals and presentations at national and international conferences. She is actively involved in professional organizations like the International Society of Dermatology and Indian Association of Dermatologists, Venereologists, and Leprologists, demonstrating her commitment to advancing dermatological care. With a commitment to excellence, she ensures personalized treatment plans tailored to each patient's unique need, emphasizing both medical management and cosmetic enhancement. Her dedication to patient well-being and satisfaction is reflected in her meticulous attention to detail and passionate care, making her a trusted dermatologist of our community. So she's going to join shortly, Dr. Richa Sanmukhani, a renowned dermatologist from Ahmedabad. And today the topic is going to be acne management. Now, you know what happens, because in our country, we are so obsessed with the home remedies, dadi ka nuska, nani ka nuska, bade buzurg kya bolte hain, it all matters to us, and it should. But then it's equally important to understand, because these nuskhas, these home remedies are way, way, way old. But now, because of the environment, the pollution level, what we are eating is not that good, pure. So there are so many things to consider now, whether these home remedies will work on us, and especially when we have a skin condition like acne. So that's going to be, a topic that we would love to discuss. Then the over-the-counter topical applications. I'm sure you have also gone to a nearby chemist shop when you had these pop-ups breakouts to ask your chemist wale bhaiya ki bhaiya ek dawai de do. And now the doctor is here with us, Dr. Richa Sanmukhani. It's such a pleasure to have you with us, Doctor. A very warm welcome to you.
Thank you, and thank you for the warm introduction. So let's start.
Yes, doctor. So today we are going to talk about acne. And first of all, we would like to understand what is acne, why it happens, what are the various grades and types of acne.
Okay. So for a layman, you should understand that acne, pimples, breakouts, blackheads, whiteheads, what you call them, they are all just the spectrum of one and the same thing. Okay. So it's basically a disorder of pilosebaceous unit, which we call. So it's basically a disorder of the oil glands on certain areas of your face. Even they can affect the glands which are present on your upper chest, back, and even on your arms. So it is a disorder of, say, you can say, increased secretion of oil from these glands. And there can be an added infection of the bacteria. Plus, there can be a hyperkeratinization kind of thing, like there can be clogging of pores, which you can understand. So because of
Mm-hmm.
which you get blackheads and whiteheads, and with the bacteria playing into attack, the inflammation which the body produces give rise to various kinds of acne.
Right.
And they can be of
Now, as
yeah,
yes,
they
doctor.
can be various grades. Like to understand the grades, like initially there can be just blackheads and whiteheads, which you see mostly on the T zone of your face. Okay, and
Mm-hmm.
they gradually progress to little inflamed ones, as red spots on your face, and then there can be even pus formation into it. Okay, which we mention as pustules. As they grow large and large, they can turn down to nodules and cysts, which are better felt than seen. So if you see on your face, there are certain lesions which are not very well seen, but when you touch, you can feel there is something big which is lying inside your cheek area or your lower jaw area. So these are nodules and cysts. So they contribute to a severe form of
Right. So these are the various grades, and then people are so confused, doctor, because often we get to hear that maintaining a good skin is important. Following a good skincare routine is important.
acne.
But then the market is flooded with products. We have so many influencers who endorse so many products. Then nowadays we have so-called tailor-made, as per your skin will supply the products. But then we are ending up buying like 10, 15 bottles in the name of regular skincare routine, and nobody is sticking to that.
Yeah.
So I think the need of the moment is to go for a very basic, minimalistic skincare routine that we can be more consistent with. So we would like you, doctor, to shed some more light over that. What kind of skincare routine we can go for, especially if we have a acne prone or oily skin.
See, if you have an acne prone skin, anyways, you're going to have certain areas which are prone to produce more oil. And it is basically mostly in the T zone of your face. So this T zone which you see on the forehead, the nose part, the chin part, and the center of your cheeks. So this zone produces more oil and it gives you more acne. So you have to take care of your face very well. So the basic steps which involves are cleansing your face regularly, then putting a like a non-comedogenic moisturizer as it suits the acne skin, then using a sunscreen which is again non-comedogenic. So anything which has a mention of non-comedogenic in it is supposed to be good for acne, like acne prone skins. But since, as you rightly said, the market is flooded with a number of products, people are confused what to buy, what not to buy, and these companies are marketing like anything. So right now, if I see patients in my OPD, everybody is coming applying a niacinamide serum, a vitamin C serum, a hyaluronic acid serum. So people are using it like what do you call, like chana mamra. This is what we call in Gujarati. So like
All
like
right.
yeah. So, but in see your acne skin, even if it is oily, it is very sensitive to the products you're using. So first, it's not that every company is selling bad products. If you are whatever good companies are which are selling in the market, so you have bought one product which is nice. It is supposed to be good for an acne prone skin, but you should use it on your own, see whether it is suiting you or not. So whatever they are making, if you want to buy that, you try it once on yourself. Even if it is supposed to be for acne, it can even aggravate your acne. So you will be a better judge for yourself. Say you have a skin which is spotless and start product, even after 1 month or 1.5 month of usage, you can see the breakouts. You have to stop using the product, wait for some time, and then in fact reuse and see if it is giving you acne or not. Or if you're confused, then better go to your dermatologist, have an opinion on what products can suit, and then accordingly use the product.
Right. So you have to be very cautious when you are going to buy products, because as we are discussing, market is flooded with product. Everybody is doing business. Everybody influencers, most of them are endorsing products because they are also making money.
Yes.
So it's not their fault, but it's our skill. So we need to be more careful about it. So just don't go for anything. In case you have doubt, as Dr. Richa has very well mentioned, go to the right person, which is a qualified dermatologist. Now, Doctor, what happens, I'm sure you'll also agree with me, and you also get patients who comes to you because after pimples, they have tried something on your face, DIYs, because DIYs are so trending these days. Then we have Dadi ka nuska, Nani ka nuska, home remedies, and people apply all kinds of things they get in their kitchen or in their toiletries on their face. They'll apply toothpaste, garlic, lemon juice, etc., etc. एंड लोगों को लगता है कि इससे हमारा पिंपल जो है ठीक हो जाएगा. सो माय क्वेश्चन टू यू इज, डू these home remedies or these DIYs, do they really work or they can be more harmful to us?
See, it all depends on how your skin is taking it. See, when you have lower grade or you just have an increased oil production, some of the things like basin, uptan, whatever we do, if you're using frequently once in a week or something, okay, so these agents are basically little exfoliating plus moisturizing. So if you're using milk or dahi or whatever, so they have little peeling agent into it, which is lactic acid from dahi. So and the scrubbing part is done by the basin which we use. Okay, and like turmeric, that is also. But because of the adulteration of these items nowadays, you cannot rely actually on these products. They may be helpful in the earlier eras, I would say, when our dadi or nani were using it, because the adulteration was quite less. But nowadays, the adulteration part, it is very difficult to judge actually what will suit you and what will not. And if you have a little severe grade of acne, moderate to a severe grade of acne, I would rather ask you to refrain from using these products, because these products will actually irritate your skin, give you more of dryness. Using it very often, then that dryness itself increases the oil production. It's a compensatory method of the body to increase oil production if your face is dry. So that's why we suggest even in oily skin, you have to put a moisturizer, the one which suits to an oily skin. So it's the excessive scrubbing, irritating your face, actually going to increase your acne. So the thing is, it is better to refrain yourself from such products if you have acne.
Right. So if you have acne or any other skin condition, be very careful. And again, we are saying it again and again, go to the right person at the right time. At the very initial point, when you see anything, acne and breakout, please go to a doctor, a qualified dermatologist. Now, doctor, after home remedies, when we as a, patient, when we, these home remedies doesn't seems to work on us, then we go for the chemist shop. ठीक है, केमिस्ट वाले भैया कि भैया देखो पिंपल हो रहा है, एक्ने हो रहा है, कुछ दे दो. And that's when we get introduced to this topical application and we love it because initially it works wonderfully.
Yes.
But then after a certain point of time, we also realizes कि अरे skin तो addict हो गई है. The moment we stop using it, we'll see, further more breakouts, etc. So, how important it is to say a big no-no to these over-the-counter topical applications?
See, over the counter applications can be various things. Sometimes, if the chemist is not aware, they have a triple combination or a quadruple combination creams, which has antibiotics, steroid, and whatnot into it. Nowadays, I've seen a combination which is 6 or 7 combination cream also available. So we call it like they have a Ramband Ilaj for everything. Okay, so you go for acne, they'll give you the same cream. You go for fungal infection, they'll give you the same cream. So it is like that. So when you're using such creams, they most of the creams have potent steroid in them. Okay, so when you acne using that cream, that anti-inflammatory action of steroid, you may feel that the acne has reduced to a certain extent. You may in fact feel that the acne spots which were earlier there because of acne, so they are also reducing, and you may feel a glow also on your face. But you don't know how to use them, plus you don't know how long to use them. So because you're getting a good effect, you tend to use them for a quite longer duration, and not see. It's not only me. A lot of dermatologists, or I guess each and every dermatologist, has seen a patient using a steroidal cream on the face and then coming with the side effects of that. So what's give you a extreme thinning of the skin? Like you can see the veins will be visible over your face. it will give you an extreme kind of sun sensitivity. So you stop the cream, and if your face becomes red, so you tend to use the cream more often then. So it's always advisable to, again, we come to the same point again and again. So get a consultation first for your skin, and then use anything which is recommended. These over-the-counter products are of no use. Sometimes, see, if you're lucky enough, they may give you just clindamycin. That's okay. That if that's the case, then it may still give you some effect without side effect. But still, you should understand the type of acne you have, the grade, the severity, what it you have, and you should act at the right time so that you don't have the after effects of acne. The earlier you work, the better results you will have. Otherwise, you'll be scarred for life. So that is how
Right.
it works. Yeah.
Right. So it's always very important to know that, in case you have acne, the moment you start seeing, breakouts, please go and consult your doctor. Again, if you are a teenager, you are attaining your puberty, you are facing these acne issues, please go to a doctor because, acne, what I feel, doctor, acne eventually goes out. That is okay. But the scars, the marks that it leaves, it's so difficult. Then they look like the bigger challenges. I'm sure you will also agree to this.
Yes. Yeah. So this is what happens when anybody comes to me for consultation of acne, even if they're consulting for something else and they have just a family member or their children having, they just want to show them to me ऐसे कि आप देख लो थोड़ा सा acne हो रहा है इसको. So I tell them that then and there, आप acne, तो you feel that it is physiological and it is going to go someday. Even if I don't do anything and little acne or grade 2 acne, it is going to maybe stop after your teenage finishes or maybe up to 25 years of age when the hormonal changes are little reduced. So, but the spots or the scars they are going to leave you with are going to remain with you with life. And the earlier we treat acne or these spots or scars, the better results we get. So I always say that acne is 100% curable. Whether it is a pathological acne, you have PCOS or something else, whether it's a pathological acne or a physiological acne, it is 100% treatable. But when you turn them to scars and spots, then it doesn't become 100% treatable. So it depends on what you're coming for treatment. If you're coming along with acne and getting it done, you may get a 95% improvement. But if you're coming post 25, side, just the scars or spots are left, then you may get a improvement somewhere around 50 to 70% depending on the technologies we have to use. And you have to use those technologies, lasers, everything you'll have to go for it. And instead, like in spite of using those, you may not have a 90 to 95% improvement. You will always have less than that.
Right. So that is why we are, again and again saying in case you have acne, please go to the doctor. Don't go for over-the-counter medication. Don't go for what the influencers are asking you to do. Don't go by the home remedies. They might work, they might not. And when they won't, they'll, be even more harmful to you. So please go to the doctor at the right time, which is as soon as you see the breakouts. Now, doctor, when a patient comes to you with acne, do you normally recommend tests, etc., to diagnose what could be the root cause, or just by clinical investigation, you're sure that what is the grade, what is the root cause, probably?
So usually looking at the patients and the the description of the actor, we also look for the other clinical features like hirsutism or hair fall, the frontal balding, or increased size. So these are the things we look for. So that there can be hormonal imbalance, there can be something called as polycystic ovaries, something of that sort. Then we usually go for also if it's a variety of acne, which to certain drugs like retinoid. Then we used to investigate the baseline and at certain intervals so as to continue our therapy to look for any side effects.
Yes. Uh, Now, doctor, what are the treatment options available?
Okay. So see, if you, it all depends on the severity of acne and what all you are coming with. So let us go according to the grade of acne. So if you have a less severe acne, call as grade 1 and grade 2, it can be corrected with the use of topical applications. By topical applications, we mean the general creams and the routine care like face wash and using a proper moisturizer, using a proper sunscreen. So in lower grades, we usually prefer topicals such as retinoid and benzoyl peroxide. So these are the topicals which we use in lower grades. We like if somebody is coming with comedon, say which we call blackheads and whiteheads, so open and closed comedon, then we can suggest certain peels and comedon extraction as the procedure part, so as to have effective and early results. Okay, but if somebody is coming with grade 3 and grade 4 acne, then definitely we would like to start the procedures along with the medications as early as possible. For severe grades like grade 3 and grade 4, in which you can judge grade 3 and grade 4 by seeing a lot of like red lesions, pustule lesions on your face, and the ones which we have already talked about, that which you feel more and you see less. So those kind of lesions, if you have on your face, then you need the oral medications. Whether it is, we can start with the oral antibiotics. So there are various antibiotics, doxycycline, minocycline. So these kind of antibiotics we use initially, and in grade 4, we use oral antibiotics. So that is the mainstay of therapy, which goes according to your body weight, and that is the only drug which reduces the sebum, the oil production in particular, along with the topicals. Like the topicals can be antibiotics, clindamycin, piroxinoxaline, minocycline. There can be retinoids like adapalene and tretinoin. It can be peroxide gel. So depending on your kind of lesion, your dermatologist will suggest what all topicals you have to use, what you have to use in the daytime, in the night time, and if it's severe, they may just give you antibiotics for a few days and see if topicals are working. If it is more severe, they'll start with oral retinoid. And again, with grade 3, grade 4, I usually in my practice start with the procedures also, because I don't want the patient to suffer from these acne, get the spots and scars, and then start the procedure. So I recommend start the procedure from day 1 onwards. So initially we focus on the procedures to reduce your acne, which can be peels or IPL live. The procedures which help, like there are different peels. It's a broad topic, but there are different peels which we use for acne. So initially we try to use those peels and subside your acne, and gradually we to things which help you in pigmentation, the hypopigmentation, the acne spots which you have, or the scars if you have. So for that, procedures such as you switch HDR laser, or we can do a dermapen therapy, or we can do fractional CO2, or microneedling. So there are n number of procedures. So we design the protocol, we customize it according to the patient, how we have to use, and accordingly we go ahead. So like this usually, I usually explain everything on the first day of consultation. You should understand what you're going for and what results you should expect. So even if you are going for procedures, if you just want to continue with the topicals or the oral medication or whatever, you should understand that what up to what level you're going to have. And if you're going or adding on the procedure, then what results you expect. Another question which patient usually ask is, मैम टैबलेट तो नहीं लेना है तक, के साइड इफेक्ट्स भी बहुत होते हैं, तो सिर्फ प्रोसीजर्स कर दो आप. So then again, this is not, I usually tell them, so this is not the way out. So your step 1 is going for the oral medication and topicals. Your step 2 is procedure. You cannot skip step 1 and directly go to step. Yeah. So only in certain cases like pregnancy, where we cannot give oral medications, we take procedures frequently, give them topicals. So it varies from case to case. Generally speaking, lower grades, the medications and the topicals, higher grades, medications, topicals, and
Right. So it goes like that. Doctor, any dietary precaution that you would like to give? Anything that we need to avoid or include in our diet? Plus, there is a similar question by one of our viewer, Pooja. Can probiotics help with acne? If you can just answer that as well.
Okay. So yes, gut has a direct connection with your acne. So whenever what you are eating makes a lot of difference in the acne part. So during my counseling session, I tell the patient, so like the medication part will take care of your 50%, 60%. Your diet and exercise part is going to take the rest 40% of your care. So you have to be little particular in your diet to avoid all these like refined sugars. Basically, a higher glycemic index food, which we call. So these are the foods which actually shoot up your sugar levels when they are taken. So they do it in a very fast manner. So like refined sugars, okay, or like high glycemic index food like milk, and so these kind of foods should be avoided. There is also a connection between dairy and acne, but it's not that you should stop taking dairy altogether. It's the excessive uh, intake of the dairy which causes acne. There is a connection with uh, chocolates also with acne. There is a paper regarding that. So because these are all high glycemic index food, so you have to avoid those. Eating, I always tell them, if you're eating healthy home cooked food, it's not going to adverse your acne. But if you're eating frequently outside, you're eating these breads, refined, oily, fried food, your water intake is less, then that is definitely going to affect your acne. It is definitely going to increase your acne. There are patients who are coming with constipation. Okay. So I've inquired a lot of adolescents and even post-adolescent people who have a history of constipation. So this is how the probiotic comes into. So if your gut is healthy, whether it is by, I don't usually advise an artificial probiotic to be taken for the treatment of acne, but your gut should be otherwise healthy. If you feel that there is a certain bowel regulation, then definitely probiotics, or otherwise if you're healthy, you don't have the acidity or the reflux issue, so not there, and you have good gut bacteria, then you can just continue with the healthy diet, fresh fruits and vegetables, and take the.
Right. So a good lifestyle, good eating pattern goes a long way in maintaining good skin health as well. Now, doctor, before we sum up the whole session, any take-home message that you would like to give to our viewers?
Uh, See, yeah, definitely. See, it is always better to treat acne at an early stage. If you're waiting for, see, there are so many people. I see, yes, I see every birthday a person who is coming with their children, and they feel that acne is very much physiological. Yes, acne is physiological. When in teenage, there can be pathological causes. Uh, I would say 30% of the cases, but rest of the 60% of the cases, it is more or less physiological. But just thinking that it is physiological, it will go one day. You should not refrain yourself from proper treatments which are available nowadays. The awareness to acne has increased a lot, and don't refrain or don't hesitate yourself कि बच्चा भी बहुत छोटा है, don't hesitate from going for the procedures. So बहुत सारे patients later सुन के ही डर जाते हैं. So that shouldn't be there. You understand the procedure first. Whatever is required only will be advised to you, and go for it at an early stage so that you're not scarred for life.
Right. Once a scar, always a scar. So scar is really very difficult to treat. So it's always better.
Yeah.
Yeah, it's
Yeah.
always better to go to the doctor at the right place, at the right time, and trust your doctor. That's equally important. Complete your treatment, trust, and follow what the doctor is asking you to do. Thank you so very much, Dr. Richa Sanmukhani, for talking to us, for having this session. It was such an informative session. Thank you so very much once again.
Thank you for having me.
It was a pleasure, Doctor. And viewers, thank you for your active participation. Stay happy, stay healthy, and take care of yourself. Have a great evening. Goodbye, everyone. Goodbye.
Thank you. Bye bye.